Hi, my name is Darrius Mehring-Ford, and we are going to go over a medical assessment for a patient today. I have already put my PPE on before I arrived to the scene. Walking on in, I've determined that the scene is safe. We are in a classroom at Fresno State, and there is no immediate threat. I've already summoned additional EMS, and I've got 4 firefighters here with me from the local fire station. I can't determine the mechanism of injury for the patient right off the scene, so we'll have to get that through our history gathering and our other sample questions. And I can tell that his spine has not been compromised at this point because he is seated upright in the chair. So we will begin with the assessment. Hi, my name is Darrius. I'm an EMR. How can I help you? All right, so right off the bat from there, he was able to respond to me as I approached him with his name, and that determines that his responsiveness and his level of consciousness are both high. What seems to be the problem today?
I have to be experiencing chest pains.
Okay, what kind of chest pains?
They're sharp pains.
Okay. So the onset is going to be focused around the chest area. He didn't say anything deep. He's just going to focus on that. So when we launch into our OPQRST, we're going to focus on that. So again, can you put the onset or where the pain is?
It's straight.
Straight in. And is there anything that you do to provoke more injury or make it hurt?
Yeah, when I stretch outward, it seems to be sharper.
Perfect. What kind of pain is this again? You said it was sharp?
Sharp.
Electric?
Yeah.
Okay. And then is it moving anywhere? Is it just when you're not moving?
Yeah, it seems to be moving like
It
towards
spreads
the outside.
across your chest.
Yeah.
Okay. When did this happen? How long ago since it started? Excuse me.
Approximately an hour ago.
About an hour ago?
Yes.
Okay. And then what is the severity when you are moving?
It seems to be hurting a lot.
Okay. On a scale of 1 to 10?
Approximately, I would say 8.
About an 8. And when you're not moving, where are we at?
Approximately a 6.
Okay. I'm just going to go ahead. Is it painful when I touch this
Yeah.
area here?
Yeah.
Okay. Alrighty. So with the OPQRST that we've gone through, I can assess some of the early signs and symptoms. We seem to be having the signs of some sort of muscular injury. Through provocation with that, we determined that it is actually in the pectoralis girdle and around the sternum. And the symptoms that he's having is radiating pain when bringing his arms back, the stretch that is caused by that. So we're going to launch into the sample. Already going through signs and symptoms for myself, continuing on. So are you allergic to anything, Manuel?
Not that I know.
Okay, and are you taking any current medications at this time?
No.
Okay. Have you ever had anything happen like this before, medically speaking?
No.
Okay. Any family history that I should be made aware of around the event? High blood pressure, cardiac events in your family?
Yes.
Diabetes pain?
My father has high blood pressure. My mother has diabetes.
Okay. And then when was the last time you ate something?
Approximately 3 hours ago.
3 hours ago? Drank anything? Water, soda?
Just water.
Just water? Same time? About 3 hours ago?
Yes.
Perfect. And then, so can you go through just the brief events of what happened as you started to feel the pain?
I was walking slowly, and after about 10 minutes or so, I began to stretch, and as I was walking and stretching, I started feeling pain.
Okay. So going through the sample history, we've determined that it's more than likely not an allergen that he's aware of, and it's not in conjunction with any medications. He stated that his father has high blood pressure and his mother is diabetic, so we might have to take those things into consideration. And it seems to be just some sort of muscular pain radiating through the movements. So he is a lower priority because he's not experiencing anything traumatic or life-threatening. At this point, I can safely assess that he's not going into any shock at the moment. So we will be transporting him to the hospital because of the type of pain that he's experiencing, but he's a low priority, so we don't have any lights or sirens. We're just going to take him on in. So moving on forward, I'm going to go ahead and assess some things right now. So if I can see your arm really fast. Going through, just going to quick. Perfect, there you are. So he's sitting comfortable at about 62 beats per minute, which is well within our normal range. We've already assessed his airway. Like I stated, he's been talking to me this whole time, so I have no problem with his airway and his quality of breathing or his quality of ventilations because he is able to form complete sentences. I don't think there's an obstruction with his airway in the light. With his skin, as I touched it, he seems to be warm, of neutral color, and it doesn't seem to be clammy. It's actually very dry to the touch. So we don't have anything wrong with his skin or his circulation. So we're going to launch into his vitals at this time. Sir, I'm going to go ahead and get some just base vital readings as we go through. So I'm just going to go ahead and assess this right here. I'm going to get your blood pressure. If you want to go ahead and hold on to these. Just relax your arms for just a second. Perfect, thank you. Alrighty, so he's currently sitting at 140/70. Since he has been walking, we can't determine that he is prehypertensive, but with his family history of his father having high blood pressure, we can assume that he might be in the same range of going through that. While I was down there, I was assessing for his breathing, and he is comfortably sitting at about 14 breaths per minute. So with the vitals taken and the signs that we've seen, we are going to move him to the hospital. I don't think it's safe to leave him here with the pain that he's experiencing, just so that he can get cleared off by a physician. On arrival, we will go over the vitals that we've seen. The reassessment process on the way will just be to monitor his vitals, go over the OPQRS, and I don't need to go over the sample again, so just making sure that the quality isn't moving, it's not getting any more severe, and if there were additional EMS services that arrive at this time, I would go through and relay all this information and release him to a higher. So at this point, we're going to move our patient onward, and that concludes our medical assessment.